Well, welcome again. Today we're in a continuing series of town coffee chats. We've been started this in order to touch different segments of the community, different stakeholders in the community, to talk about how the COVID-19 crisis is affecting our local area. And this morning we have joining us Dave Smith, who's the CEO of the Canadian Mental Health Association of Peel and Dufferin. I have Jennifer Moore, the Executive Director of Dufferin Child and Family Services, and Kim Delahunt, who's the President and CEO of Headwaters Healthcare Centre. Welcome all this morning, and thank you very much for joining me. I wanted to start off just by talking about a meeting I had. It's a little more than a year ago, and some of the board members from the Central West LHIN reached out to me for a meeting, and I forget the gentleman's name who was the chair at the time, but he and a couple of board members came to meet with me. And the thing that I took out of that meeting was what I thought was kind of shocking. It was underfunding of this area. The numbers that were presented to me was something like 50% funding compared to the rest of the province, and I didn't quite understand the reasoning. I was really scratching my head, and they didn't have any reasoning either. But I guess because of some of those anomalies, this new Ontario Health Team process has started. And I'm wondering, Kim, if we could start with you and just share a little bit about that exciting news that we have got through your Hills of the Headwaters Collaborative and the support of the province in creating this new Ontario Health Team to service our area. Really great and exciting news for us. So can you just share a little bit more about the Ontario Health Team and how it's going to impact our region going forward?
Sure. Thank you, Mayor Brown. We are very fortunate that the Hills of Headwaters Collaborative Ontario Health Team is one of the first out of 24 that were announced in the province. It is a very exciting model that is really helping bring partners together to really look at creating an integrated system of care, serving health and social services for all of the residents. And in our case, it's across Dufferin and Caledon, which is about 114,000 residents in total. And so we're fortunate as well in our geography that a lot of our organizations have already been working together for the past number of years. But this opportunity has really strengthened those partnerships and have brought many more to the table. Fortunate to be on the chat this morning with a couple of the great partners that are part of the collaborative. And when you hear them speak about their involvement as well, it really shows the diversity of the partnerships and that it crosses age spans and different groups, again, brings in social services. And again, we're really looking at some of the top priority areas of need across the Hills of Headwaters Collaborative Ontario Health Team, which are providing more mental health and addiction services, ensuring children and youth have all the supports that are necessary in the families. We're also focused on our palliative care populations. And then, of course, really looking at our most complex residents with multiple care and social needs, and really looking to make that experience more seamless and more integrated so that they don't have to repeat their story. And of course, every sector has a role to play, and it's really about ensuring that they get the care they need when they need it in the right setting. So really, really fortunate that Headwaters Healthcare Centre is a partner, and we've got many other great partners that are on the chat with us this morning.
Wonderful. One of the things that that came out of that discussion was mental health resources in our area particularly, and I think mental health professionals. And it's interesting, we're on this new platform of doing business in Microsoft Teams, and I know Zoom, and I imagine that this is some of the silver lining in this issue, is that we're now able to connect in these ways. And I wonder if medicine and counseling is going to be this type of platform is going to be used going forward to tap into the professionals that may not be in our neighborhood. Is that something that's going to happen, Kim, do you think?
I do. I definitely think so. And, I think I might get Dave Smith to speak about that because I think he's already changed some of his business model and approaches, and
Right?
especially for that vulnerable population. Dave, do you want to add what you guys are doing at
Mhm.
CMHA?
Please.
Yeah, so when people started to change the way they were working, we used it as an opportunity to look at a model we've been trying to implement for a while, which is more on-demand services. Traditionally, you apply for mental health support. There's a process of assessment and triaging to specific teams. What we're trying to do in this time is if somebody calls our line, because we have more availability, because we're not traveling to people's homes, what we can do is answer the phone and do direct service. And we do an hour of counseling or problem solving right at the time that the person will call. And then we have a set of virtual groups and virtual follow-ups for people afterwards. And the in-person visit only comes after at a point where we feel we need to be there in person. So we still have in-person services when they're necessary, but we're very much more able to respond in real time when a person calls with real mental health support. And we've seen an uptake in the last 3 weeks since we started advertising that of about 300%. So.
Wow, fantastic. That's great. Jennifer, being the director of Dufferin Child and Family Services, you're, you're kind of at the epicenter of some stress and anxiety that hits families, and I presume you've had an uptick in the need for your services. Can you share with us how you've changed your delivery model and how you're coping with the increase in stress and anxiety that are hitting families and children?
Sure. So we've made many similar changes that Dave described. So for about 6 weeks now, we've had people available 24 hours a day, 7 days a week to pick up the phone in person and to be able to be there for folks whenever they're needing either child and youth mental health supports or parenting supports, sometimes behavioral supports if their child has specific needs. So we've done that. We've also implemented an online booking platform because sometimes when people are in the moment, especially with young children around, it's difficult for them to pick up the phone. But if they know that they can carve out a specific amount of time at a certain time of day that works for them, they can go ahead and book online, and it makes it a little bit easier for people. We've also engaged in a number of parenting groups and youth groups online as well to keep people connected. We are seeing people still as well, but again, in fairly high risk situations. And it's not our everyday course of service delivery at this point in time. I think the other thing that's really important to mention around children and families and youth is our connectivity with the school boards and other service providers. So we are meeting at least once a week, if not twice a week, with our various school boards in the community, because teachers right now are one of the only conduits for support for young people in our community. There's a lot of isolation, and that concerns us quite a bit.
Right. In my position on the police service board, I had opportunity to have a presentation at your facility regarding the situation table, and I know that you pull a number of organizations in together, including police services, to talk about specific cases. And can you talk about the successes of the situation table and how, really mental health hits a lot of different areas of society, including, criminality and education and homelessness and people trying to hold down a job, which leads to, a successful life. And if you can't, then, so share a little bit more with the public about the situation table. I don't think everybody understands it completely.
So the situation table has been in effect for about 3.5 years now, and we've been lucky in the Dufferin area, and this has actually been something that's helped to build our OHT platform in Dufferin and Caledon, to have really strong partnerships from the very beginning. Being a small community, we've had to rely on one another and wear a lot of different hats and be flexible. And that's been a benefit for all of us. But the situation table provided some additional benefits in that, particularly our police services, when they were dealing with high-risk situations in the community with respect to mental health, addictions, homelessness, things like that, they would deal with the situation, but not always understand whether or not there's been any follow-up, and sometimes not even know how to make those connections for appropriate follow-up. So one thing that has been a significant benefit for the situation table has really been that community service providers, including police services, have a much better understanding of what one another do and a much better understanding of the types of supports that can be offered, and also the autonomy of choice that individuals have in terms of following through with treatment that may be recommended or supports that could be available. So it's been very helpful that way.
Right. One of the things I wanted to talk about today was, I guess, a bit of a silver lining in the midst of some of the crisis and tragedy, and that's with respect to long-term care. And really that seems to be the place where a lot of this problem is resident. And I think again, I don't know if silver lining is the right word to use in the midst of this kind of tragedy, but there's going to be a tremendous amount of focus, I think, on long-term care facilities, the protocols that they use, the safety and hygiene within these facilities is going to have to be reworked. And Kim, I know that some of your staff has been redeployed to help some of our local long-term care facilities. And can you speak to that a little bit about how you've partnered and helped those facilities locally?
Sure. Yeah, I sure can. And it is really heartbreaking to see the situations that are unfolding in our long-term care homes and other congregate settings. And again, what's really great with our area is the strength of our partnerships. And so we have asked for volunteers at Headwaters to come forward to go into Shelburne long-term care residents at this point. And we've had staff asking how they can help. So we've had a number, over 10, so nurses and personal support workers or PSWs that have volunteered to go in. We need to support them even more. So we're continually looking at strategies, and it is a really great partnership, not only with Headwaters, but with our public health partners, with the central region and home and community care. So kind of collaboratively, we're working with the owners of Shelburne and with their staff, and it's really a day-to-day situation. There are daily calls with a number of partners. Again, we're tapping on some other partners in the area, like the Dufferin Area Family Health Team and other organizations, to see if they can lend a hand as well, because the situation is evolving daily and we need to stay on top of it. So we're continuing to recruit as well at Headwaters, looking to hire more personal support workers, looking at some other options. Our EMS partners are ready should we need to do any transfers, but we're really continuing to look for volunteers to go in at this point to support.
It's very interesting. The provincial government has identified wage as one of the problems and has stepped up and given bonuses to some of these workers in these settings. And I know, sitting on Dufferin County Council and getting updates from Dufferin Oaks from time to time, that workforce is a real problem, and maybe wages are going to have to go up in order to attract more people to work in these environments, and that may yet happen. Dave, I wanted to ask you about fear and anxiety in long-term care homes. Have you had some experience in that? Is there people have been reaching out to you for some advice and help with respect to long-term care specifically?
In long-term care specifically, we have actually a couple of homes that we're now we've put social workers in to support communication with the families. So sitting there with an iPad, connecting with the family, letting them see that their loved one is still there and okay. That's one of the problems I think that has happened as a result of the sort of over the greater need that staff have to support residents is that the connection with the family was missing. So we've been doing some of that work, and family members, of course, are very worried about the situation for some of their relatives in homes.
Mm-hmm.
Generally, actually, we're seeing a much greater level of worry and anxiety across the entire population, though. So there's been a couple of polls just to check on mental health of people in their homes, and you're seeing over 50% suffering from heightened levels of anxiety, 66% of worry. There's a lot of increased early mental health indicators that are not good right now.
No. I know. I keep watching these updates from Mr. Trudeau and Mr. Ford, and hoping that a light is seen at the end of a tunnel, so that people can start to feel that this is ending. I know we're still concerned about transmission of this disease in the community, and the government is still having us stay at home and respect physical distancing as much as possible. But we need a light. We need something to focus on to get us thinking positively, because there's been a lot of negativity over the past several weeks. It's unfortunate. Jennifer, I'm looking at the notes here. I'm just wondering if you could share with us some of the important things that the community needs to know about how they can be supported by your services at this time. Can you give us just a breakdown of if anybody needs help, how they can access and what services are offered currently?
Yeah, absolutely. So I think the first thing I would say is that it's been alluded to before, our partnerships across service organizations in our community is very strong. And so people could call any one of us for anything that they need. And if it's maybe even not the most appropriate call, they're still going to get some service, and they'll have a warm handoff to whoever should be more appropriately involved. So I think that's the most important thing to say. I would say there is a group of mental health organizations, ourselves, DAFT, CMHA, Family Transition Place, who are all working together to try to ensure that there are adequate supports for our healthcare providers. So many of us at this point in time are choosing to ignore what the lanyard around our neck may say, and step forward and say what is needed in the community.
Right.
So people can reach out. We have DCAS has a crisis number, CMHA has a crisis number, Family Transition Place has a crisis number. All of our websites are really clearly indicated in terms of how people can reach out for support. And really, in all of our minds, we are trying to create the best type of community response as possible. And we're also very conscious of the need to do pandemic planning to help to ensure that we've got adequate supports for mental health in the community on a go-forward basis as well, and not just right at this very moment.
Right. Kim, I was looking at the list of Ontario health teams, and you picked the word collaborative to put into the name of your this Hills of Headwaters Collaborative, and it's really interesting because you talked about collaboration with the long-term care home in Shelburne. So that's a perfect example of how this group of partners can pull together and help the community, and it's really a great example of that. So good on you. Can you share with us, Kim, a little bit more about the current situation at the hospital? Just how the staff are making out, morale. Are you okay with equipment? Is there anything else the community can do to help Headwaters right now?
Sure, thank you. That's a great question. So in regards to the staff, I would say that, and I think it's not just at Headwaters, but everywhere, it is a challenging time for sure. They're working really hard. We're doing our best to keep them safe, ensure they've got access to the personal protective equipment that they need. And safety is our top priority, but of course, everyone is an individual, and they're even worried about their personal lives, their families, their children, and being safe and making sure they have everything they need. So I would say, morale is great, morale is strong, but there are ups and downs each day, and we're doing our very best to support staff and offering, obviously EAP supports on an ongoing basis. We're doing mindfulness moments each week. We do a daily shout out at the hospital at 11:15 every a.m. where we recognize a department or team, and there are loud cheers and shouts across the hospital. Next week, we're
Right.
actually going to be playing some uplifting music each and every day, just to kind of, again, keep the morale up and to really recognize all the departments, frontline, and all the supporting services at the hospital. So, and, in regards to our volumes, so our volumes are lower. Obviously, we've stopped doing all non-essential services. And even our ED volumes are lower. We're at about 50% of what we normally would be, similar to our occupancy, although it is starting to increase. So we're just adjusting to what's coming through the doors and really still continuing to provide the best service that we can. In regards to the community, I can tell you that we are just astounded at the support of the community, of local businesses, of individuals, and the donations that have come in, both monetary and in regards to PPE, food, caffeine, all kinds of great things have been donated. It really, again, just shows the strength of our community and the commitment of everyone to not just supporting the hospital, but supporting each other. I really think that's a testament. Our hospital is supporting other partner organizations if they do need access to PPE as well, because we really are in this together as one community. So we, as Jennifer said earlier, we will do whatever we need to. It doesn't matter what lanyard is we're wearing. We really just are doing the best to look after all of the residents and families across Dufferin-Caledon. In regards to, some areas of need, I think, we continue to look for donations for N95 masks, surgical gowns, surgical masks. We've had some big donations from the school board for gloves, so we don't need any more gloves, which is great. And we're fortunate to actually have some partnerships with Dufferin County in regards to storing some of the great donations off-site, which is wonderful. But I think, just some N95s, some other respirators, half visor masks, and gowns, and that would be needed. I do want to just give a shout out that, since March 23rd, our foundation has actually, I'm just gonna look at my number here, we've raised just shy of $675,000, which is just amazing. And that's to just support COVID-19 and all the various things that the hospital needs to purchase. So it's amazing. We've had some matching campaigns that have occurred with some really generous donors in the community. So I just wanted to make sure I mentioned that, because we are very grateful for the support of the community.
Yeah, we do have a very giving community in Dufferin-Caledon, absolutely. Dave, I wonder if you can share with us any needs that your organization might have from the community. Is there anything that we can do to help your organization?
It's similar stuff. We've, I think in mental health in general, there's one of the problems with going virtual is many of our clients are very impoverished and don't have
Technology.
either phones or enough data to participate in some of the virtual care options that are there. So we've actually had recently got 100 phones with 3 gigs of data for 6 months donated by TELUS, which was a lovely gift. We've had some additional donations that are money towards food cards. We can use things towards phone technology. I think all the mental health partners would be looking for those sort of items that help connect disconnected families and clients into our services.
Right. Very good. Very good. So we're getting close to being out of time here, but Jennifer, I'm just wondering, have you in your organization been recipients of some of the generosity of our community as well?
Yeah, we absolutely have been. And, we're constantly astounded as well as at how incredible our community is and how generous they are. And I think the only thing I would add to what Dave and Kim had to say in terms of needs would be our biggest need is to make sure that as community members, we keep promoting the fact that all of us are open. We are open in a different way, but we are here for you. We're here for the community, and we want to make sure that people know that they can feel very comfortable to reach out for service, and we will do everything we can to meet their needs.
Right, wonderful. One last question to you, Kim. I'm just wondering about the assessment center. We're getting bombarded by information from the United States and Canadian news outlets about testing, and I'm not a healthcare professional, but it would seem that if the testing can be ramped up, it might allow us to open up the economy a little bit more. And has there been any talk about a wider type of testing than just those who are symptomatic right now?
Yeah, certainly. So our assessment center is ready, and we have the supplies and staffing to assess essentially anyone that comes through. So we definitely have the capacity. So since we started on March 19th, we've assessed over 3,500 people. Now, these individuals that have come through, they're not all from Dufferin-Caledon, I will say that. There's a good sized proportion that come from outside our area, but that's okay. I think to your point and to the messaging from the province and the country, the more people we can assess and swab, the better. So our center has capacity for sure. So I would definitely encourage anyone that has symptoms or feels they need to be assessed to come through the assessment center. We've got no plans as of right now to shut it down. We are actually looking at kind of a longer term option and some sustainability and how would we keep it going indefinitely. So we're just starting to look at that, but we're open. We continue to remain open. It's a great partnership between a number of partners like the Orangeville Police, the Dufferin Area Family Health Team, Home and Community Care, the Dufferin Paramedic Service, and of course staff from the hospital, and St. John Ambulance earlier on was there. So staffing is strong. We've got the supplies. We will continue to assess and swab for as long as we need to. And it is very important to get as many people assessed and swabbed as possible. So I would encourage everyone. I do want to just give a shout out as well to our primary care physicians who have been integral in our assessment center day in and day out. And I would say even in all of our activities, I think across all of our partner organizations, we're really fortunate to have a strong group of primary care physicians in our area that, again, really step up to do whatever they need to support all of our residents across many, many service lines.
Wonderful. So Dave and Jennifer, just maybe one last final thought. Anything you'd like to say to those out in the public right now? I just wanted to say from the bottom of my heart, thank you to all of you and your organizations and your staff for stepping up in this very difficult time. So we know we've got great resources here and that the community is well taken care of. Dave, did you want to have a final thought, final comment?
I think I'd echo what Jennifer said. If people need help, reach out. We're here.
Great, very good. And Jennifer?
Yeah, you know what? We're going to get through this as a community, and things may not ever be quite the same, but we might even be that much stronger. So keep hopeful.
Right, good. Well, thank you all for joining me this morning. It was very enlightening, and keep up the great work that you're all doing. And thank you so much for for doing what you do for our community. All the best. Thank you.
Thank you.